Now, Ghana is nearing effective containment of Covid-19 as latest data supplied by the Ghana Health Service reveals a significant reduction in active cases and new infections. In its latest update, the service says active cases have dropped below the 1,000 mark to 856, the lowest in months. Head of our health desk, Chris Smith, has more.
The data reveals 4 new deaths, bringing the death toll to 280. But there is some good news about the country's battle with SARS-CoV-2. Positivity rate dropped from 65% at the start of August to 10% on September 1, signaling the country's strategy may be working. Only 55 positive cases were reported from the labs in the last update, one of the lowest recorded in many weeks. But it takes Ghana's case count to 44,713. Of this number, as many as 97.5% of patients have recovered. So far, 4 of the 16 regions are without any active case, whilst others are reporting single or double-digit figures. Only 3 regions, Greater Accra, Central and Ashanti, have active cases above 100. It may still not be time to rejoice yet, as further easing of the restrictions could trigger a second wave. The reopening of the country's international airports and the possible start of political rallies all point to risks requiring significant attention.
You heard the head of our health desk, Fred Smith. Dr. Yabidiako is an immunologist with the West African Center for Cell Biology of Infectious Pathogens, and he joins us. Doc, a good sign or not? Should we be excited already?
Good morning, Bernice.
Good morning.
Yes, I think we should be. I think even like in the story, the presenter said we can't over celebrate right now, but we can at least be cautiously optimistic that things are at least appearing not to get worse. The drop, whenever asked about this, I always say, drop in case count on its own can be a bit misleading because this virus is only detected if you test. And I think you will find that in addition to the number of positive cases dropping, the number of tests has also been lower. So we are not testing as much as we were before. Now, that may be because, I know the Ghana Health Service modified its testing strategy from early on doing mass contact tracing, mass testing, to more targeted testing of specific of people who are sort of considered to be suspected cases. So the fewer tests may represent the fact that there are fewer people presenting with obvious symptoms, and so we are testing fewer people. But this does not necessarily mean, obviously, that the virus is still not spreading within the community. As we've already established, a large number of the populace are asymptomatically, of the infected individuals are asymptomatically infected. So I think the test positivity rate dropping is a promising sign, demonstrating that of the tests we are doing, a lower number are positive than before. However, the test positivity rate is still higher than what we would like. So of the people we are testing, we are still getting more than 5% to be positive, which I believe would still put us in a situation where we have to be very, very cautious. Now, of course, as we continue to ease restrictions, there will be some concern about whether or not we will see a second wave. And also, as the virus, currently the virus has been concentrated in our urban areas. There is the concern, obviously, that as it spreads, will we begin to see greater cases in
the rural areas?
Areas, yes.
Doc, there is a very interesting twist to this whole COVID situation in relation to the African context. And there was an article published by BBC that caused some bit of uproar on social media. And that article was trying to use the poverty situation in Africa to either explain or not why we seem to have fewer cases of COVID in Africa and fewer deaths as compared to other parts of the world. And obviously, as against the prediction or expectation of even renowned scientists across the world. What exactly, from your point of view, let's contextualize it, let's bring it home to Ghana. Do we know for sure why the numbers are dropping. Aside from not testing less, there have been rumors about immunity and a lot of people developing herd immunity in Ghana. Can you just touch a bit on that?
So yes, I saw this article in the BBC. I think it makes some interesting points. I think they got into trouble because they painted the issue as well, almost as if poverty is a positive thing in this case. But yes, there is evidence that Africa has reported lower numbers of cases. I think we have, in terms of the number of cases, I am of the opinion that a large amount of that is actually due to the fact that Africa has not tested anywhere near as much as other places. So in terms of raw numbers of cases reported, Africa is very low. That probably reflects a lack of a capacity to test. Ghana has been one of the leaders in Africa, but even in Ghana, our capacity to test is not on par with, developed countries in Europe and North America. Having said that, certainly it would appear as though the case fatality rates in Africa are much lower. Ghana, we are around 0.5%. You contrast that with the United Kingdom, which is around 12%, the US, which is around 3%. Ghana and indeed much of Africa are doing very well. Now, some would argue that even that could be a factor of testing. So people may be dying, but we don't test them, so we don't ascribe their death to COVID. There is certainly a possibility of that, but I believe that if we were seeing 12% fatality rates due to COVID, there would be many more people dying in hospitals, and so we would have seen that just increase in deaths across the country. So certainly it appears as though Africa has not suffered the same fatality. Now that, in this article you reference, they do mention the age, the difference in age. So Africa has a very young population. The average age in Africa is 19. So age is a significant risk factor when it comes to death from COVID. Countries with older populations have seen more deaths. So I believe the age factor has played into to our benefit. But then also there is possibility, yes, of exposure to other infections may have primed or tolerized our immune system to a certain point to make us less susceptible. But I would caution that we are still exploring these questions. I don't think it's going to be a simple answer. I suspect there will be multiple factors that each have contributed to the fact that Africa has lower death. Now, you asked about immunity. Are we seeing immunity now? Actually, in terms of immunity, that might reflect that we've had more transmission than we know of. So a paper just came out from Kenya where they predict that in Nairobi, for instance, they think they have about 40% exposure to the virus. And so they think they are beginning to approach certain amounts of herd immunity in pockets around the country. And I wouldn't be surprised if that would be similar in Ghana. So as I said, even though our testing suggests, low double-digit numbers of exposed people, if you actually went out to do an epidemiological survey looking at serology, as we have actually begun to do at the University of Ghana, our initial results are demonstrating that there's actually much higher levels of exposure to COVID, to SARS-CoV-2 in Ghana than would be expected. We are getting, in some parts of Accra, we are seeing rates close to 30%, which would fit with this Kenyan story. We've just been fortunate that all these people, majority of them have been asymptomatic. And so perhaps because of the crowding, because of the easy transmission that occurs in certain parts of our urban areas, we've actually managed to achieve higher levels of exposure, which has then led to a certain amount of immunity, which may be responsible for the declines we are beginning to see. The question we have, though, is will this immunity persist? And as the virus moves into areas that have not yet been as exposed, will we see increases in cases in these sort of more interior areas?
Situation, like you say, the virus is dynamic. We're still learning about it. We're still understanding. I remember when New Zealand declared COVID-free, and within a day or two, there were reports of 14 people contracting the virus. So good news for Ghana. We're falling below the 1,000 mark. But what should we be doing so that we can at least maintain the figures we are hopefully on a downward trend?
I think we have to stay vigilant. As you said, there are a number of countries that thought they had won the battle only to relax and find that they have more cases. I think even South Korea, that has been lauded for their approach, has had to close their schools again because they saw outbreaks. So just when you think you've got a handle on COVID, it can rear its head again. So I think we have to maintain a high degree of vigilance. This is the time, as I've said before, if indeed our cases are dropping, this is the time to actually keep our foot on the pedal to try to drop the virus below even detectable levels. So we need to ramp up our adherence to the protocols. It's very disturbing, as the president himself has discussed in his last address, that adherence to the protocols has declined in Ghana. People are not wearing masks as much as they were. I believe even sales of hand sanitizer have dropped compared to before. So there is a sense of certain laxity or complacency that I believe is creeping in, and we could pay a heavy price for that. So I believe this is the time for us to be extra vigilant, to be cautiously optimistic, but to keep the protocols in mind. And especially as our international airport is open and people are coming in, yes, there are controls in place to try to stem the tide of any new introductions, but no method is foolproof. And I think we have to realize that in itself creates a certain level of added risk that we have to keep in mind.
Thank you very much for your time this morning. I appreciate it. Dr. Yao is an immunologist with the West Africa Center for Cell Biology and Infectious Pathogens. And we've been talking about recent figures from the Ghana Health Service indicated that our active case count for COVID is below 1,000. Some good news, as many will want to believe.